Amoxapine tablet is used to treat depression. Treating depression can improve your mood and sense of well-being and allow to enjoy everyday life more. Amoxapine is a tricyclic antidepressant. It works by restoring the balance of natural chemicals, neurotransmitters in the brain. Because amoxapine has some effects that are similar to those of major tranquilizers, it may work better in patients who have agitation or anxiety along with depression. Indications. Amoxapine is indicated for the relief of symptoms of depression in patients with neurotic or active depressive disorders, as well as endogenous and psychotic depressions. It is indicated for depression accompanied by anxiety or agitation. How to use. Effective dosage of amoxapine may vary from one patient to other. Usual effective dosage is 200 to 300 mg daily. 3 weeks constitutes an adequate period of trial providing dosage has reached 300 mg daily, or lower level of tolerance for at least 2 weeks. If no response is seen at 300 mg, dosage may be increased depending upon tolerance up to 400 mg daily. Hospitalized patients who have been refractory to antidepressant therapy and who have no history of convulsive seizures may have dosage raised cautiously up to 600 mg daily in divided doses. Amoxapine may be given as a single daily dose, not to exceed 300 mg, preferably at bedtime. If the total daily dosage exceeds 300 mg, it should be given in divided doses. Initial dosage for adults. Usual starting dosage is 50 mg 2 or 3 times daily. Depending upon tolerance, dosage may be increased to 100 mg 2 or 3 times daily by the end of the first week. Initial dosage of 300 mg daily may be given, but notable sedation may occur in some patients during the first few days of therapy at this level. Increases above 300 mg daily should be made only if 300 mg daily has been ineffective during a trial period of at least 2 weeks. When effective dosage is established, the drug may be given in a single dose, not to exceed 300 mg at bedtime. Elderly patients. In general, lower dosages are recommended for these patients. Recommended starting dosage of amoxapine is 25 mg 2 or 3 times daily. If no intolerance is observed, dosage may be increased by the end of the first week to 50 mg 2 or 3 times daily. All from 100 to 150 mg daily may be adequate for many elderly patients. Some may require higher dosage. Careful increases up to 300 mg daily are indicated in such cases. Once an effective dosage is established, amoxapine may conveniently be given in a single bedtime dose, not to exceed 300 mg. Maintenance. Recommended maintenance dosage of amoxapine is the lowest dose that will maintain remission. If symptoms reappear, dosage should be increased to the earlier level until they are controlled. For maintenance therapy at dosages of 300 mg or less, a single dose at bedtime is recommended. Contraindications. Amoxapine is contraindicated in patients who have shown prior hypersensitivity to benzodiazepine compounds. It should not be given concomitantly with monoamine oxidase inhibitors. Hyperparity crisis, severe convulsions, and deaths have occurred in patients receiving tricyclic antidepressant and monoamine oxidase inhibitors simultaneously. When it is desired to replace a monoamine oxidase inhibitor with amoxapine, a minimum of 14 days should be allowed to elapse after the former is discontinued. Amoxapine should then be initiated cautiously with gradual increase in dosage until optimal response is achieved. The drug is not recommended for use during the acute recovery phase following myocardial infarction. Precautions. Some young people have thoughts about suicide when first taking an antidepressant. Stay alert to changes in your mood or symptoms. Report any new or worsening symptoms to a doctor. You should not use amoxapine if you have recently had a heart attack. Don't use amoxapine if you have used an monoamine oxidase inhibitor in the past 14 days. Drinking alcohol with amoxapine can cause side effects. Avoid driving or hazardous activity until now how this medicine will affect you. Your actions could be impaired. Amoxapine side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Report any new or worsening symptoms to a doctor such as mood or behavior changes, anxiety, panic attack, trouble sleeping, or if you feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactive, mentally or physically, more depressed or have thoughts about suicide or hurting yourself. Amoxapine may cause serious side effects. Call a doctor at once if you have skin rash, fever, uncontrolled muscle movements in the face, chewing, lip smacking, frowning, tongue movement, blinking or eye movement, pounding heartbeats or fluttering in the chest pain or pressure, pain spreading to a jaw or shoulder, sudden numbness or weakness, especially on one side of the body, slurred speech, problems with vision or balance, or severe nervous system reaction, very stiff rigid muscles, high fever, sweating, convulsion, fast or uneven heartbeats, tremors, feeling like you might pass out.